So the challenges of maintaining CAR T-cell response are multifactorial, and maybe it's important to go back one step. Why this question is being put forward, and that is because although response to CAR T-cell therapy is very good, we see very high response rates, including complete responses and also high rates of MRD negativity. We do not see a plateau at the moment when it comes to progression-free survival. So ultimately, all the patients that have received CAR T-cell therapy will probably relapse. So that's why we have to think about mechanisms of CAR T-cell therapy failure. And I think a better understanding of these mechanisms of CAR T-cell therapy failure will also lead to improvements that probably will lead to a better duration of the response. So when you talk about the challenges then, I think one of the challenges is persistence of the CAR T-cells. Probably the longer the CAR T-cells persist, the longer the response will be. And then there are multiple factors that are probably influencing persistence of CAR T-cells. Those are the characteristics of the T-cells that are being harvested during the leukapheresis procedure. Another factor that's probably important is the way the CAR T-cells are being manufactured. And another important factor is also the type of CAR construct that's being used. We do know that murine or llama or other animal-derived CAR constructs may lead to humoral and cellular immune responses that may hamper the persistence of the CAR T-cells. So one step forward may be to make CAR T-cells with a humanized or fully human external CAR construct. And those studies are now also being performed in multiple myeloma. Another challenge when it comes to persistence of the response is the fact that patients may develop antigen escape variants. So the tumor that progresses has lost the expression of the antigen that's being targeted. So maybe one strategy to address this is to treat patients with a pool of CAR T-cells. So one pool of CAR T-cells targeting one antigen and another CAR T-cell pool targeting another antigen, so that you prevent early escape of the tumor. Maybe better is even when you have one CAR T-cell expressing the two CAR receptors at the same time, because there is some data that results in better CAR T-cell activation and better immune synapse formation. And then I think the last important point that I want to mention here is that it's not only about persistence of T-cells, but it's also about the activity, the activation status of the CAR T-cells in the bone marrow. And we do know that multiple myeloma is a disease that's growing in a very immune suppressive microenvironment. So I think we need to have a better understanding of the potential negative effects of the immune suppressive microenvironment. So the effects of Tregs, regulatory T cells, on CAR T cell efficacy, but also the effect of myeloid-derived suppressor cells on CAR T cell activity, and maybe a better understanding of that may lead to next generation CAR T cells, armored CAR T cells, or combination strategies that lead to a better improved duration of the response.